Well, starting next week, clinical trials will be taking place across the country with the goal of getting Health Canada approval for a kit that lets people test themselves for HIV. Sean Rourke from St. Michael's Hospital is one of the researchers leading the study, and he joins us this morning. Good morning, Sean.
Morning, Matt.
Let's talk about this here first, too, and we're going to show people because 1,000 people are going to be using this HIV self-testing kit at clinics starting next week in Toronto and then on to Montreal, Winnipeg, Saskatoon, and Victoria. So first of all, I guess, Sean, how does this kit work exactly?
So it's straightforward, actually. It's a kit, you unpack it, there's test instructions, there's some vials, something to prick your finger, and a little well with a filter there. And essentially, people follow the instructions. They prick your finger, put it into a vial with some solution, mix some solutions together, put it in the well on a filter, and within a minute, you have your test result.
Okay, and so they're looking for a change of color, though, too, right, in the test itself?
Yes.
Okay. Now, what is Health Canada? It's taken a long time, I think, too. We're going to get to that in a second. But what is Health Canada looking, and what do they need to see from this study in order to approve these kits for sale to the public?
So this test is effective. It's accurate. It's over 99% accurate. The last thing we need to do, and the data that Health Canada needs to make its final decision about approval for this test, is essentially to make sure that people can follow the instructions, unpack it, read the instructions, follow the test procedure, do it, and then interpret the results correctly. So we're seeing 1,000 Canadians across the country to make sure those who are the intended users of this test will be able to do that effectively. And that's the data that Health Canada needs to go to the next step.
Okay, now Canada has fallen behind when it comes to self-testing too. In fact, Canada was one of the only developed countries that HIV rates are still rising. But we have a look too. France, Germany, the UK, the US all have approved these self-testing kits. Why is Canada, and why has it taken so long for this to happen in this country?
Well, I think there's a couple of reasons, and one is leadership. The other one is probably political will, because the science is there. We, as you can tell, or as you mentioned, these tests are available around the world. Why aren't they here in Canada? There are over 9,000 people living with HIV who don't know that they have HIV. We need to help find those people. I got a note from a colleague, a mentor, a community activist this morning, just a half an hour before our interview, and said, you know what, those 9,000 people, if they don't get access to the treatments that can save their lives, they actually might die, or probably will. So this can't happen in a country like Canada. So we need to do better.
Yeah, and when too, so this study is going to happen over the next how long, and when could we see the kits actually rolled out for sale?
Right. So we're revving up. We're so excited about just getting this underway. We're going to start next week. It'll take about 3 or 4 months. Everybody's really excited about just getting recruitment going, hitting that 1,000, getting the data to the company. This is a Canadian company as well, I should point out, in BC. Have them bring the data to Health Canada towards the latter part of the fall, certainly by the end of this calendar year. And then once Health Canada has the data, the regulatory folks will review it. Hopefully by early 2020, we'll have an approved test kit that'll be available for all Canadians.
Okay. Sean Rourke, a very important thing to do. Thank you for being here this morning. I appreciate it.
My pleasure. Thank you very much for having me.
Thanks for watching. If you like this, be sure to subscribe here.
And you can check out more Your Morning videos right here.